points with 25G needle. And I target layer 4 and also layer 2. This is layer 4. If you elevate your cannula, if you see the full shape of the cannula, then it's layer 2. If you see bluntly elevated, then it means that you're in the layer 4. Just slowly and keep the compression with the same pressure of the right thumb or your palm. And move gently. And also, this is targeting the lateral area for the tear trough. I recommend this 2 puncture point because if you just feel the medial side, it will suddenly feel like hollowness of the lateral side. So I would recommend 2 puncture point and use this. The amount is less than 0.2 or 0.5 cc per side. And use jumper thread. This is 27 gauge, but usually I use 23 gauge to hold or suppress hard the orbiter fat. And I totally agree with Dr. Park with penetrating the orbital ligaments. 2 threads or 3 threads in the same puncture point is perfectly fine. The same method, hold the guide tube and remove the cannula, and then remove the remaining guide tube. The before and after photo with HA fillers and jumper thread is quite impressive, right? This is the other patients. And her. Even if they have large eye bag, but we can apply like these method with the right direction or right side of the injection points. So this is how I did to her tear trough correction and also mid-cheek groove correction. And as you can see, there's a and also for these sharp wrinkle or sharp depression area, I use 30 gauge 4mm needle with like very soft filler to correct this. The amount is less than 0.1 cc. And also we could use this kind of jumper thread to hold or suppress the orbiter fat like this, or correct the depression with HA fillers. You can target layer 4 and also layer 2. If you want to change the direction or the layer, then you have to pull the cannula fully out and insert it again. Okay. And this is how I do the jumper thread. Make a puncture point with 18 gauge needle and widen a little bit because the threads covers the outside of the cannula. So I target the layer 4. And by using a pinching method with your left hand, it will be easier to target the layer 4 and hold the guide tube and then remove the cannula and remove the remaining guide tube. That's all. Doesn't feel very much of pain. And also tear trough. It was already covered from Dr. Park, but I'll explain once more. You can also target it with 2 cc per points to support the ligaments or connective tissues. It's quite easy. And this is the other side. And also, this is how I